Good morning. Today we will talk about screw and plates. As you know, there are many implants used in orthopedics to fix two fragments of the bone. It may be due to trauma or removal of tumor or osteotomy to correct the deformities. The screws fix the plate to the bone. So screw converts the torque into the internal tension along the screw axis. So screw converts torque into the internal tension along the screw axis. It enables compression between two surfaces. Two fragments can be brought together. So a screw has got many parts. This is a head, then countersink, then run out shaft and threads and tip. So head is a conical structure, and there is a core diameter or root diameter, which is the solid core of the screw, out of which the threads are cut. And between the distance between two threads are called thread diameter, and the amount of distance which screw travels in a complete circle is called the lead. Or there is a different type of threads are cut, V threads or buttress thread. Buttress thread are flattened on one side, so it does not come out easily. As you know, the bone is like a cylinder, and there is in between the bone there is a marrow which is filled with the soft tissue. So only two cortex are available for the fixation of the screw. So we had developed many advances in this screw. So in osteoporotic bone of old age, we can get maximum purchase. So screw head is larger than the core of the screw, so it does not sinks in the drilled hole, and it does not go inside the plate hole also. It acts to prevent the translational motion of the advancing screw. There are many type of slots are there in the head, so then we can rotate the screw. There is single slot, cruciate slot, Phillips head, and hexagonal head is the most common type. This is the single slot, this is cruciate slot, and countersink. It's a conical inserted center and perpendicular to the hole, and hemispherical, can be angulated, maintains concentric contact between the screw and plate, and conical thread surface, locking plates, and inclination is not possible. There is a shaft which can be partially threaded or fully threaded. It's the region linking the screw head to the threads. And this is a smooth threadless area of the shaft, and it is the core diameter of the screw. And this is where the threads started. And a screw thread, their diameter is more than that of the threads or the core diameter of the screw. Outer diameter of the screw is the diameter of the threads, while inner diameter is the core diameter of the screw. The outer diameter determines the pull-out strength of the screw. Larger the diameter, greater is the pull-out strength. And inner diameter gives the tensile and torsional strength to the screw. Pitch is the distance between the two threads. A small pitch, greater mechanical advantage. Cortical screw has a pitch of 1.5 mm or 40.5 threads per inch. And cancellous screw, it has got 2.75 mm or 9.2 threads per inch. Lead is the distance traveled by the full turn of the screw. A small lead, the greater mechanical advantage. And threads may be V-type or buttress type, in which one part of the thread is flattened, so pull-out strength is more. Thread tips may be of various types. There is a self-tapping type, in which tapping is not required. After drilling, we can directly put the screw. It is thread forming and thread cutting, and there is a flute to cut the threads. No pre-tapping is required, so tight fit can be achieved in osteoporotic bone. And non-self-tapping, the thread extends to the tip, and pre-tapping is necessary, and greater torque can be produced and greater resistance to the pull-out, mainly done in the cortical bone. Cork screw tip, it forms thread by compressing trabecular bone, and mainly used in cancellous bone. And trocar tip does not produce true threads, it displaces the bone pieces. Manular screw, Shan's screw, locking screw for the intramedullary nail have trocar tips. Self-drilling, self-trapping. In this screw, no pre-drilling is required. Tap is present in the tip only for the locking plate and osteoporotic bone. And may injured many neurovascular structure that are lying just beside the bone. Cortical screw, it may be machine type, usually fully threaded, and a smaller pitch and lead are there, so greater pull-out strength is there, and large core diameter. Threads are of less diameter, spanning of threads is less, and compression force in cortical bone is 2000 to 3000 newtons. Can function as a positional or leg screw for interfragmentary compression by over drilling the near cortex. Cancellous screw is a wood type, like we use screw in the not hard wood, large threads, higher pitch and lead, a small core diameter. Core diameter is small, but the thread diameter is more. Increased pull-out strength and more purchase in the cancellous bone. There is a two diameters are available, 4 mm and 6.5 mm, and thread lengths are 16 mm or 32 mm. Shaft screw, no self-tapping type, partially threaded, and shaft diameter is equal to the core diameter, and better strength and stiffness it's used as leg screw or axial compression screw. Manular screw is used in manular fractures, and it is 4.5 mm wide. No tapping is required. Trocar tip is there, and it is used for medial malleolus fracture. Removal is difficult. Screw breakage may occur.